In this film, we'll show you how to help if an adult suddenly collapses and is not breathing normally using compression-only chest compressions. Even if you've never received training in CPR, your actions can still save a life. The most important thing is to act quickly, call 999, start chest compressions, and keep going until help arrives. Before you go to help, make sure the area is safe for you and others. Look for dangers such as traffic, electricity, fire, or broken glass. If it's safe, approach the person. First, check for responsiveness by gently shaking their shoulders and shout, "Are you okay?" If they do not respond, shout for help. If someone is nearby, ask them to call 999 and put their phone on speakerphone, and get an AED if one's available. If you're on your own, use your mobile phone on speakerphone so the call handler can talk you through what to do. Next, you need to check for normal breathing. Tilt the head back slightly and lift the chin to open the airway. Look for normal breathing for up to 10 seconds. Check if the chest rises or falls normally. If they're not breathing normally or only gasping, treat this as cardiac arrest. Tell the 999 operator that the person is not breathing normally. They will dispatch an ambulance and guide you through what CPR needs to be done. Now you need to start with chest compressions. The EMS operator can tell you what to do. They may say, place the heel of your hand in the center of the chest, put your other hand on top and push hard and fast. Kneel beside the casualty. Place the heel of one hand on the center of the chest between the nipples. Put your other hand on top and keep your arms straight. Push down hard and fast about 5 to 6 centimeters and release fully so the chest can rise. Continue a rate of 100 to 120 compressions per minute, which is about 2 compressions every second. You can keep time to the beat of a familiar song such as Staying Alive or Baby Shark, both of which have the right rhythm. Keep going until help arrives and do not stop unless the person starts breathing normally or moving, emergency services arrive and take over, or you become too exhausted to continue. If an AED arrives, switch it on immediately and follow the spoken instructions. The device will tell you exactly when to stop compressions and when to start again. If the person begins to breathe normally, stop compressions, carefully roll them onto their side into the recovery position, keeping the airway open and the head tilted slightly back. Stay with them and monitor their breathing until help arrives. The key points to remember are: call 999 immediately and put your phone on speaker. If the person is not breathing normally, start chest compressions right away. Push in on the center of the chest, 5 to 6 centimeters in depth, 100 to 120 times per minute. Continue until help arrives or they start breathing again. Use an AED as soon as possible and follow the voice instructions. And even if you're untrained, doing something is always better than doing nothing.